Yeah, this is really a problem. Patients who are progressing during the manufacturing have to receive, of course, bridging therapy. And if you cannot control the progress, you have to decide if infusion of CAR T cell would be still helpful, feasible, and would lead to cure. So we have to check whether we find any treatment option or irradiation to get the disease again under control, because what we know is in high tumor burden with high LDH levels and high ferritin levels, and patient CARs will more rapidly expand but then also exhaust, and this would not be for the long term helpful in control the disease. So this is the most important thing.